Hello and welcome to India Fights back on Rajya Sabha TV. I'm your host Rajat Kain. Well, in this episode of the show, we'll discuss role and safety of healthcare professionals as we observe doctors day to day. Well, when the COVID-19 virus struck the world last year in the year 2020, it caught most of the world unprepared and unleashed havoc of unamounted proportions. Millions of people have lost their lives so far, and the situation has been grim in certain parts of the world. Amid all this, our doctors and medical staff put their best foot forward and worked tirelessly to save precious human lives. When things got worse during second wave of pandemic, we saw hospital getting overburdened by a number of patients. It was still a medical support teams and the doctors and the specialists who fought the virus, treated patients, made sure most of the patients who suffered COVID-19 stayed alive. They were given CPR, they were revived amid the second wave of COVID-19 virus. Well, how important it is for us to acknowledge and to understand what our medical fraternity is facing and the risks they face each day while fighting this virus. To discuss further on this issue, we join with Dr. Rana Singh, Medical Superintendent and Director, RML Hospital, Delhi. Many thanks, Dr. Rana Singh, for joining us, and Dr. K. Madan Gopal, he's Senior Consultant Health from NITI, Aayog, Government of India. Many thanks, Dr. Madan Gopal, for joining us. Let me start with you first, Dr. Rana Singh. Sir, how difficult, challenging, rewarding, I'm just saying, or rather cataloging everything in the one, has been last, I would say, 18 months ever since COVID-19 has struck?
It's a very difficult but a very comprehensive question to answer. How difficult it was, it is quite understandable. The task was enormous, the problems were galore, and for every healthcare workers who were performing duties in the COVID zone, every time they go for duty, they were carrying risk on their life and the life of their family members, the loved ones. Because by chance, if they carry the disease with them in their household, not only they will get affected, but their loved ones will also get affected. So the task was enormous. The reward was also, I can tell you, unimaginable. Like healthcare professional, I'm a doctor. If you truly ask me what gives me the most divine happiness in life, when I treat a patient, especially a patient who is serious, who is in difficulty, and if I cure and send that patient back into the family and into the society, believe me, if you can, without meaning or without exaggerating, this gives me the most divine pleasure. But it's a very natural pleasure. So reward was also enormous. We were able to help people. And who were the people? People, our own countrymen, our own people. And many a times, in the whole lot, we also got people whom we knew, who were even related to us. But that apart, because we were treating these people who were suffering from a very catastrophic illness. It's a terribly deadly virus. So when we struggled with their management, we worked hard on them, and at the end of the day, when we were able to send them home in the pink of their health, then that reward or that divine pleasure, words won't suffice to express that. So difficulties were enormous, but the reward was also enormous. And risks, I have already said that when you are into a profession, you decide the day you join the profession that yes, I am made for this, I will do this, I'll perform the responsibilities which is bestowed on me, no matter how difficult it is, no matter how risky it is. So it was a mixed bag. And I mean, one of the most important thing which now I can express is because the COVID has, like touched at this point of time, another our positivity rate is, like 0.1% or so, which is close to zero. So that is another, factor which is giving us enormous happiness and enormous satisfaction.
Right, right. Certainly. Many thanks, Dr. Rana Singh, for your remarks. Dr. Madan Gopal, here, sir, your opinion. Do you agree that this is possibly the most challenging phase the Indian medical fraternity has faced of late?
Yes, Rajat, first of all, greeting to all my fellow doctors on this occasion. We collectively has stood the test of the time and shown our resilience in these very difficult and tiring times. That's the opening statement which I want to make. Apart from that, what Dr. Rana has said, that it was a very tiring time because when the first announcement of the pandemic came, with no treatment around, we don't know, the treatment modality was not clear. The mode of transmission was essentially surface-based at that time, along with that. And to further vitiate that thing was that availability of the PPE kits in most of the hospitals. Looking at all these hardships and other things, still the medical fraternity, they came forward and they have given their time, and this the risk obviously was known to them. But somebody has to take the risk to prevent the lives and the humanity and the mankind. Otherwise,
Right.
who will come forward? Somebody has to come forward, take care of the lives during this tiring times. But obviously, what has happened, as we see how we have taken lessons from all the countries, and our treatment protocols and other things, they have evolved, they have matured. As a result, what has happened, that though at a particular some point of time the system was overwhelmed, but we could at least manage to bring down saved many lives. That is a
Right.
good satisfaction which we are having. Apart from that, during the overwhelming time when the system could not handle on few of the days, then also 24/7, all the doctor brothers and the other persons, they were on call. They have been assisting based on their knowledge. They have extended the application of their knowledge for managing the patient in their own settings. That means that the home-based care has evolved during this time also. And looking at the way people walking out, you might have seen that people are walking out of the wards after 2 months. 2 months, if they are walking out, that means it's an effort. It's not
Absolutely.
only just providing a prescription and giving, it's the other thing day to day, because you know what medicines are there, but at what time, what titration is to be done, how to change it, that's a whole thing, and that requires a constant interaction with the patient. And knowing that there is no available things, the PP kits were in shortage during the first wave, they have handled that crisis very nicely, and it gives a contentment and satisfaction, seeing how the pandemic is taking shape, how the numbers are coming to normal, and looking at the way the Western countries they have taken the. I'm not able to express that, but
Right.
looking at that, the catastrophe there, but we have been able to manage with our medical staff, medical professionals, everybody, we have been able to manage beautifully, and it gives a lot of contentment and satisfaction on that. Over
Right.
to you, please.
That's important point, as you mentioned, that there was a shortage of PP kits and basics in the first wave. So have we been able to cover it up to a large extent possible, Dr. Rana Singh? Is our doctors getting, at least for their own shield, enough PPE kits and other apparatus that is extremely required in this pandemic, and especially during the second phase?
In the first phase, there is no doubt we had shortage of practically everything. But in the second phase, the challenge was totally different, because the second phase, the COVID suddenly burst like a volcano. So in that kind, the kind of numbers which were coming to the hospital, the kind of severe patients who were coming to the hospital, at that point of time, there was, there was disruption of supply chain, one after the other, like you short out the oxygen requirement, then you fall short of remdesivir, you sort out the remdesivir, you fall short of the steroid. So, like there, I mean, because it is suddenly, burst like a volcano, the requirement went skyrocketing. And then, in spite of the best management, you will feel the pinch of shortage of one thing or the other, at some point of time. Being said that, we were able to manage it very nicely. We have to, like make some kind of, local adjustments. Like one day we had shortage of, like probable shortage of oxygen. Then I had to talk to the Honorable Health Minister. Then he talked to Chief Minister of Haryana. And then that was sorted out in a very small period of time. So the difficulties were there, but we were able to sort it out. We were able to solve the problems. And how nicely we could handle it, I'll repeat with the figure that positivity rate 0.1 is close to 0. So that is what is the achievement. And on what Dr. Madan Gopal said, I just like to add, it was not only, like standing and performing duty in the PPE kit in a COVID zone. There were no relatives in the COVID zone where the patients were kept, because we could not have risked the life of the relatives of the patient. So relatives and patients were disconnected for everything, from breakfast to toothbrush to going to the toilet to emptying their, like urine bags. Everything was done by the healthcare professionals. And on top of that, because of the disconnect with the family were apprehensive on one side and the patient were apprehensive on other side. So at the same time, we also had to, struggle with that. But we were, like kind of striking very fine balance, and we were successful. There is no doubt about that. And the ultimate parameter of the success is, which I expressed, I am going to express third time, is the number which exists today. So I think we have managed this catastrophic illness. Not only we have managed it well.
Dr. Rana, before I move to Professor Madan Gopal, let me ask you one important question here. So as you mentioned that, this time around, things were very different in terms of treating patients, as patients did not have their family members beside them, whereas which obviously gives a psychological boost to any patient, be it in the ward or the private room or anywhere. Now, doctors say at the same time they're also kind of performing duties as counselors to the patients. So what sort of a mental toll has the entire pandemic, and second wave, all of us acknowledge that has been catastrophic, has taken on the medical fraternity? Do we need to do something in terms of in that respect, in that regard, for the doctor, for the medical fraternity?
The challenge were enormous. There is no doubt. And the biggest challenge for anybody while performing duty is, if somebody thinks that my life can be consumed while performing duty. And this feeling all of us had, that yes, when we enter into that COVID zone, we may get infected, and we may pay the price in terms of our life. And our people, the healthcare workers, they have lost their life. I have lost people, my own colleagues and friends in my hospitals. So, but the problem is that morally or otherwise also, we never thought that we have an option not to go to the hospital, not to see the patients, not to treat the patient. Well, let us look at the whole scenario. If healthcare professionals don't look after these patients, who would do it? Who would do it? So when we had joined our profession, we knew that what is the mandate of our life, what is the relevance of our life for that matter. So that motto, that mission, that kept us going, knowing fully well that yes, we are carrying the risk not only on our life, our family members also, but that motto, the mission, the target, the aim of saving the life of the countrymen, that kept us going. And if we listen good words from people around, that Dr. Saab bada acha ho gaye, we are so much thankful, that is good enough for us. So that is how we managed ourselves.
Right. Good words and pat on the back on the doctor, especially it's rewarding, as says Dr. Rana Singh. Dr. Madan Gopal, do you also agree that, this has been a difficult time, challenging time, not just as a professional for the medical fraternity, but also at a lot of personal footing as well.
Yes, Rajat, it was very challenging because once in lifetime people come across this kind of challenges. That means at one way you feel that you want to help people, other time you feel that you are very helpless. During the peak of the time, even I could not find beds for many people. That was the helplessness which was having. Otherwise, anybody used to call me and I could be able to arrange beds in private as well as government. That was the helplessness which I have experienced during this time. Nevertheless, we have found a way to tackle this situation as well, as I mentioned earlier. But I will just continue where Dr. Rana has left. That means good words, at least some good words have to be spoken about the doctors who has treated. Okay, that starts and that motivates. In the profession, it gives a lot of contentment if somebody recovers from a certain illness, irrespective of whether the person is known to me or not known to me. If you look at the symbols of the doctors, even the serpents which are coming, we would be treating them. It goes with that motto. It's not that we are going in with a kind of intent that hame ye karna ho. No. Even somebody is not associated, not know, kitna bhi jahil raho, you are going to treat them with the same passion, with the same intent, so that he recovers and goes back. That's
Right.
If he goes back smiling, that gives a smile and gives a contentment. There are many gestures are more said than words. If that gesture is also there, we are very happy, we are very contented. That kind of thing is there. Then another aspect which usually talks about this COVID is, as Dr. Rana has mentioned, during the first wave, the relatives are not allowed. Apart from that, if you do the ergometric analysis of the doctor who has put in work, as per the protocols, after 4 hours duty, the doctor has to go out of the COVID ward.
Right.
But we have to see that where is the manpower? If that person is not, who else is there to take care of that? And as a result, what has happened? Many of our doctors, they'll end up doing more than the hours which are prescribed as a normal standard operating protocol. As a result, we have lost many of our colleagues.
I was coming to that only. Yes. You mentioned that, Dr. Madan Gopal. As per Indian Medical Association, 798 doctors died in second wave alone. So, in terms of caveats and of course looking forward, what is that do we have for our medical fraternity, frontline workers, and the treating staff and the hospital staff for future, and especially for a pandemic-like situation? The health and assistance.
Rajat, this is very important question because we need to answer this. If you look at if you just do an analysis, how much time this housekeeping staff has given, how much time this nursing staff has given, how much time these doctors have put in, you will be very surprised that with 1/3 of the staff, all of the things have been managed. They require a number of people. If you look at the developed countries where the ratio of the doctor to beds is very different.
Right.
The ratio of nurse to beds is very different. And there is a particular set of duty hours for the doctors. That means in the AIMS they have the protocol. That means for 4 hours they would be doing this thing. 4 hours, after 4 hours they need to be shifted from the COVID ward to the other ward for other duties. But essentially in practice it could not happen. As a result, you might have seen that the doctor getting exposed to more infection, and some of them they have succumbed to this infection. Over to you, please.
Right, sir, right. And Dr. Rana A.K. Singh, sir, your take on that, sir, in terms of, say, health safeguards for the health worker, frontline workers, what more is required besides, of course, vaccination?
I think, I'm telling you, it was like a war-like situation. And if you are in war, then you will have to be prepared to pay the price.
Okay, na?
As I said earlier, during the first wave, we had shortage of protective equipments and everything. Second wave, that was not the problem. So one of the most important, the thing which keeps us going, I have already told you, because it's mandated on us. It is our responsibility and duty to save the life of our countrymen. We have to do it. We do not have option not to do it. Uh, but as I said, uh, there are ways by which the morale of this group, healthcare workers, can be enhanced.
Right.
And if the morale is enhanced, I'm telling you, the worst fracture is the fracture of morale. So, and the society collectively and the society has done it. Let me acknowledge that when our honorable prime minister said ki thali bajaiye or tali bajaiye, and at that point of time when we were looking at the visuals, people, like standing in the street, from the balcony, from everywhere, when the people were cheering up, like healthcare professionals, healthcare workers, we were able to appreciate the sentiment behind those loud noise which was made, that they are cheering up us, they are telling us that, look, you have the responsibility and you are carrying forward your responsibility. You are saving us. You are our saviors, and we acknowledge it. So that has rock solid impact on our mind, on our
Right.
psyche, and that kept us going. So that kind of morale boosting from everybody, from the society, from the leader like Honorable Prime Minister, that really works as a wonder. And
Right.
that is something which will keep us going, which has kept us going. And if we face the challenge all over again, I'm sure I can convince you, I can give you commitment that we will not back out.
Right, right, right. Dr. Rana Singh, just as we go toward the close of the show, sir, I mean, as we're talking about, there has been like a hypothesis about the third wave or likely third wave or n number of waves. So, how are you looking forward and preparing, or rather, at least your staffers, if we talk of the medical fraternity?
About the third wave, I have got only one take. When I talk about third wave with the people, I get a feeling as if we are waiting for the third wave to come and hit us. My take is totally different. It is in our control, not that third wave come and knock at our door. We religiously and rigidly follow the corona appropriate behavior in
Right.
terms of mask, social distancing, hand sanitization, and if we get vaccine without thinking, whenever our turn comes, if we combine these two weapons, the third wave can can end up being an imagination only. So
Right.
our whole aim should be not to allow the third wave to come to us, and it is in our hand. But if we lower our guards, then probably the same way, like before the second wave, we have already seen the situation, we have already paid the price, and that price is too enormous which we have paid during the second wave. So I, through you, I will earnestly request my viewers that let us not lower our guard, let us
Right.
not wait for the third wave to come,
Certainly.
let us stop that phenomena to happen altogether.
Right, certainly. So this is we keep urging our viewers as well. I mean, the pandemic is not over yet. So please keep following COVID appropriate behavior and get yourself vaccinated as per government rules and regulation. Whosoever is eligible. Yes, Dr. Madan Gopal. Just as we close the show, I just have a minute with you, sir. As we talk of the third wave. So safety tips, or for that matter, looking forward towards the healthcare professionals, what perhaps can be done so as to make them, or rather for their own safety?
This is a time to be more vigilant, because the third wave is in our hand, whether we want it to happen or not. The healthcare professional, this is a time for increasing the vigilance, increasing the surveillance, besides not lowering the guard, following appropriate behavior, COVID appropriate behavior, till sizable population is vaccinated. That's one thing. Second thing, as we are taught in our profession, that means you should not be lowering guard in dealing with
Right.
any of the patient. We should be adopting the universal precautions which we have to take while treating a patient or in a ward. That we have to follow. If
Right,
there is
right,
any
sir.
lowering the guard, the healthcare professionals, which are the backbone of the system, so they are at risk. So
Right, right.
nevertheless, we will see
Certainly.
that the third wave never comes in this country with our behavior, with our responsibility.
Absolutely, sir. We also wish the same. At the same time, we also urge our viewers once again to follow COVID appropriate behavior and get yourself vaccinated. Many thanks, Dr. Rana A.K. Singh, for joining us. Many thanks, Dr. K. Madan Gopal, for being a part of the show. Well, that's it in this edition of India Fights Back. Goodbye.